There is mixed messaging from the provincial government about whether a new surgical funding model will see hospitals compete against private surgical facilities for provincial funding. That's what the Premier seemed to say in a video Monday. She also suggested that hospitals were intentionally diverting funds earmarked for surgeries away to other parts of their administration. Those allegations have angered healthcare professionals. Kevin Green explains.
That means funding.
In a video released Monday, Danielle Smith said private clinics and public hospitals will be pitted against one another for surgical funding.
Because we'll foster competition. So all medical centers, whether charter surgical facilities or hospitals, get rewarded for delivering results for patients.
But hours later, in a written statement, the health minister's press secretary said the opposite, writing, "The suggestion that chartered surgical facilities compete with hospitals reflects a misunderstanding that would apply in a privately funded system." The Health Sciences Association of Alberta says the apparent contradiction shows the government isn't trying to manage health care. Rather, it's managing public opinion as it dismantles the public system.
There has been a concerted effort to decrease the funding through a public model in this province for a very long time.
In that same video, the Premier alleges that hospitals are misusing provincial money, essentially wasting it instead of doing more surgeries.
In fact, hospitals will often stall on surgical procedures so they can use their global funding in another way. So even if a hospital promised to perform 300 surgeries, they may only deliver 100 with no accountability for administration.
CTV asked the Premier's office to clarify her allegations of funds being misused. Her staff told us to ask the Health Minister those questions. Adriana LaGrange walked back the Premier's comments this way.
What the Premier is wanting to say, and what I believe she was trying to say, is in fact that when you have global budgeting, there is no incentive to actually do more.
Cuts, cuts, cuts. Chaos.
The opposition NDP agree there's a problem, but accuse the government, not the hospitals, of being the ones misusing funds.
So there is an enormous amount of waste and corruption through the entire system. We can't spend $240,000 for an anesthetist at the Royal Alex Hospital. Instead, we'll spend $500 million on private surgical facilities that are more expensive and do fewer surgeries.
Kevin joins us now. So, Kevin, the health minister said she heard from surgeons who say they can't get enough time in operating rooms. But what about the other professionals working on those procedures?
There are an awful lot of people working in a surgical suite that aren't the surgeon themselves. I've spoken to many of them today, and not one of them tells me that they have seen evidence of surgical suites being shut down by hospitals so money can be diverted elsewhere. What they do tell me is that they've seen surgical suites shut down, but that's because there aren't enough support staff to keep them open and operating. Tara?
Okay, Kevin, thank you.